presentation. The next speaker is Dr. Ehsan Adeli, who is an assistant professor of psychiatry and behavioral science, and by courtesy of biomedical data science and computer science. He is also serves as co-director of both the Stanford AI for Mental Health Initiative and the Stanford AGILE Consortium. He heads the Stanford Translational Artificial Intelligence Lab, which leverages AI to improve clinical care and deepen our understanding of aging and neurodegenerative disorders. For his work, he has received numerous awards. Besides his impressive accolades, Dr. Adeli has the unique ability to transform your any living room into a living research lab. He will talk about this ability in his exciting talk, Precision Mental Health Meets Transitional AI, Neural Mechanisms and Individualized Digital Biomarker Trajectories. Dr. Adeli, please.
Wow. Thank you so much, Gillian. And I just want to say it's actually very hard to talk after Tina and right before Jonathan, two superstars. So bear with me. All right. I want to talk to you a little bit about neural mechanisms and individuals' digital biomarkers and how my lab is using AI to create this connection and create and understand the neural mechanisms behind some of the neurological disorders. So with that, I want to start by saying that human actions are an integral part of our daily lives, from everyday activities like tying our shoes to playing musical instruments. Behind each action, there is a complex interplay between neural circuitry and how the actions are performed. The brain has to process information, plan, and coordinate the necessary responses. Beyond motor skills, the cognitive processes in the brain underlies our ability to perform intricate and complex activities. And some of these cognitive processes involve perception, attention, memory, learning, decision-making, problem-solving, and language. These cognitive processes help us interact with the world and be able to perform actions in a purposeful manner. We know that the brain operates as a network, and if any of the regions or circuits in the brain get impaired, the downstream impacts result in misfiring some of the connected networks and them losing their regulatory powers and so on. And all of this results in an array of psychiatric, behavioral, or motor symptoms. And my research is to first observe these symptoms through AI algorithms, try to quantify them, trace them back to the networks in the brain, and ultimately, again, use AI and imaging to predict and intervene. This motivated me and my lab to study motion and brain circuitry. On one hand, motion, where we use digital devices and also videos to quantify motion, and on the other structural and functional MRIs. So with that quick-ish intro, let's look at some of the things that we've been doing on quantifying motion, mostly through contactless sensors, but there are some wearable devices as well. Starting with this is a clinical test, a time doubling test that we only recorded it on, it should be a video playing, on an iPad, and you can see the video, the iPad video on the left, and we can using AI algorithms, reconstruct the entire movement, the motion, and then also the body joint movements. And on the right, you see a wide array of measurements that we can extract. This means that we can quantify the entire walking cycle, and not only that, also extract a few measurements that can ultimately result in or be part of a list of digital biomarkers that could be used for movement. It's not just walking. All types of clinical tests using our AI algorithms, 3D reconstruction algorithms, we can quantify those movements. And this is an example of a short physical performance battery test, or SPB test, that is run to check individuals' balance and quite a few other skills, and that is recorded on a smartphone camera, again through algorithms, quantified fully and completely. Beyond computer vision and using these cameras of the smart sensors and so on, we have been using some variables, including this example that you can see in the screen, a smart glass, where we can look at the world from the individual's point of view perspective. And that also gives us access to quite a few other sensors. And you can see that the green trail is the walking space, the walking trajectory of the individual recorded by the glass itself. And again, using our AI algorithms, we have been able to fully and completely reconstruct the entire body's motion and movement only and only based on what we see on the classes. And it's not just accurate reconstruction, it's also been able to quantify and detect some of the abnormal walking patterns, again, through some of the machine learning and AI algorithms that we've been developing. This was we just recently tested this against motion capture, and we've been able to see very accurate minimal errors when it comes to ground truth single standard motion capture. So that was how, in a nutshell, the story of how we quantify movements, the entire body movements. And then on the use of structural and functional MRIs for quantifying brain and networks, I don't probably need to talk much about it for this group. We've been using standard algorithms to turn the functional MRI images and structural images into brain networks, and then use some new graph neural networks and deep learning frameworks to predict some of the clinical scores that we've been gathering with together with those videos. So with this, we've been able to create encoders of brain, computational data-driven encoders of brain networks. And that led to, so as I said, motion was quantified by these skeletons and movements, and brain circuitry was quantified by the functional MRIs and analysis that I just showed you. But we are interested in neural mechanisms of the motion impairments, right? So in order to create that connection, we've been doing some exploration. One of those was through canonical correlation analysis, which resulted in this paper published last year in Nature Machine Intelligence, where we summarized both of these modalities into vectors and then tried to create a common space, a correlated space between the two. And then when we tested this on individuals with Parkinson's disease who have abnormal movement patterns, we've been able to identify those correlated measurements between the two very diverse modalities, as you can see here, with a very strong correlation. And this resulted in us thinking of, okay, so let's look at what we learn from these algorithms and the neural mechanisms that we've been pursuing. Looking at the movements by observing velocity, movement of the joints, and rotation angles, and so on, we've been able to find these significant differences between the groups, and not only on that coordination between left and right side of the body. And then all of these impairments and patterns that we've been identifying, we also found the correlated neural mechanism, correlated functions, brain functions that relate with those. So this made us think that we are creating this proxy. So why not turn this into a mobile app that can track the digital markers, and those digital markers are proxies of brain impairments. And then, so this type of measurement is scalable, repeatable over time. You can track it over time for progression and recovery, and generally it's an automatic extraction. Let's take gait speed as one example, and there's evidence around it that if it's tracked longitudinally and over time, it can be a very early indicator of cognitive decline and accelerated brain aging. So with that in mind, I wanted to bring up another example that we've recently completed the study around, using same type of data of imaging videos and audio data for accurate detection of depression and anxiety during pre-visit rooming stages of and use machine learning multimodal algorithms. In the pre-visit stage, we asked individuals to fill out those 3 questionnaires, PHQ-9, GAT-7, and the demographic survey. And then the individuals, participants, were engaged in a conversation with our clinical team, which they answered questions, they provided responses to 11 questions, and they were video recorded, audio recorded, and then the audio was transcribed. Using these 3 modalities of data, we've been developing multimodal algorithms to predict these anxiety and depression scores. First, using a simple traditional deep learning framework, we were able to not only do a good, relatively an accurate system for prediction of those scores for depression and anxiety, we've been also able to identify some markers, some gesture markers that highly correlate and contribute to those significant predictions. Beyond that, the first work was done using 5-fold cross-validation, full training, and so on. More recently, we tested large language models, and this time we didn't conduct any training, so all of the data was used for evaluation, almost all of the data, where we used chain of thought reasoning and in-context learning, and we've tested a few state-of-the-art LLMs, as you can see, GPT-4o, Gemini, the Meta from Google, and Llama, which showed promising performance in being able to quantify, to predict the clinical scores, the PHQ-9 and GAT-7 scores in terms of both binary classification and also predicting the significance, the progression, the level of severity of the disease. And the LLMs were also able to summarize and show us how there were differences in word usage between those who were positive with respect to anxiety and depression scores, using more filler words, and negatively balanced words more often. With that, I want to just summarize that it's not just those smart sensors or videos that could be used for assessing and extracting digital markers. A few of this ecosystem of digital area that this digital ecosystem could be actually something that can be used at home environments, as Kilian was saying, through wearable sensors, portable sensors, even inner body sensors, and mostly where my research and my interest is around ambient and contactless sensing technologies. With that, I would like to wrap up, say, we talked about this complex interplay between brain and human actions and behaviors, and data-driven approaches can actually facilitate understanding this complex interplay and may result in novel, multifaceted markers and biomarkers. Thank you so much, and thank these institutes for supporting.